This was a sobering day in the battle against the Ebola outbreak. As the death toll climbed, the first patient diagnosed in the United States died, and plans for screening ramped up at major American airports. The CDC is at the center of the government's response, both here and abroad. Special correspondent Kathleen McCleery got an inside look at how the agency is tackling the job.
CDC Emergency Operations Center. This line is being recorded. Watch Officer Baker speaking.
The Emergency Operations Center at CDC headquarters in Atlanta never sleeps. A quiet hum belies the frenzy of activity here.
Just remember, it's under 2014 Ebola International.
This is the nerve center for the effort to contain and control the Ebola virus. CDC Director Dr. Thomas Frieden.
We work to protect Americans, and we do that with boots on the ground in every state, in 50 countries around the world. We do that by the top quality science and scientists, and we do that by action.
We are the watch team here at the CDC. We're basically like the CDC's 911.
Gordon May oversees the watch station, which gets calls from the public, the media, and health officials.
They're seeking information on what to do with their patients. They're seeking information on waste disposal. They're also seeking information on protocols in the event that they do receive an Ebola patient.
The questions are fielded by others, about 150 in all, who work in this high-tech hub. Plasma screens display giant maps pinpointing places the virus has been found and areas where even more CDC staff have been deployed.
Okay, good morning, everybody. Welcome to Monday. It's day 90 of the EOC activation.
Top managers meet daily to exchange updates on the number of cases and the global response. Dr. Barbara Mann attends that meeting. Her team is monitoring the Texas investigation into the first case diagnosed in the U.S. and tracking people who may have been in contact with Thomas Duncan. After serious missteps in Dallas, the CDC and others faced a flurry of criticism, including the hospital's response when Duncan arrived.
I guess the way I look at it is that preparedness is really a process. It's not a state or an activity. It's a process and it's a state of mind. And so what we need to do in this situation is to learn everything we can from those bumps in the road to try to make it go better, and hopefully there won't be, but if there is another case.
The CDC's attention goes well beyond the U.S. border. The Global Migration Group focuses on air and sea travel, including outreach to passengers. The group's leader is Dr. Marty Cetron.
The most important thing that we're trying to do is help fill in a gap between the public health sector and the transportation sector in terms of readiness. Our job is to train people how to ask questions about symptoms, how to ask questions about exposure and risk, whether they've had contact with an Ebola case, and how to measure objectively in a safe way temperatures of people who are intending to leave, identify those people, and move them out and prevent sick people from getting on airplanes that could potentially spread.
Are you focusing mostly on Liberia or all
of the heavily affected countries?
Okay.
Epidemiologist Amy Summers is a disease detective, just back from Liberia. More people have died there than in any other country. Summers helped find those who may have been exposed, a process called contact tracing.
There are a lot of challenges in Liberia, and I think probably the most challenging part of it is that there's a lot of stigma attached to Ebola there. So people are basically running away because nobody wants to be associated with it. So there was one case that we went out with, and by the time we got there, all of the contacts who were associated with that case had fled the area.
Teams in West Africa process specimens to determine if patients have Ebola. Here in Atlanta, scientists are working on genetic sequencing to see if the virus changes.
I worry when people have irrational fears of Ebola, but there are rational fears as well. If you're a healthcare worker taking care of a patient with Ebola, you'd better be scared, and you'd better use that fear to make sure that you do absolutely everything right when you're caring for that patient.
What are we supposed to do?
Well, you can go over to the second ECU.
Okay.
The CDC has sent scores of its own staff to Africa, but many more are needed. That's why they're offering hands-on exercises like this one in Alabama earlier this week. 36 healthcare workers came to this rural spot to learn how to put on personal protective equipment, suits, masks, boots, and gloves. Dr. Michael Young, an influenza expert who has turned his focus to Ebola, put the curriculum together.
What we tried to do is create a facility here that mimics an Ebola treatment unit in West Africa. We're not trying to recreate a U.S. hospital where there's much higher levels of technology available, and we're not trying to recreate a general hospital in West Africa. It's a specific facility for caring for Ebola patients. What we ask our students to do is do a practical exercise, a hands-on exercise every day of the 3-day course. Today they did a simulated blood draw.
For nurse Heather Bedlin, drawing blood is easy, but wearing heavy gear will make her job tougher when she leaves for Liberia this weekend.
You know, it's warm here, it's hot in West Africa. The goggles fogging, of course, that's a little bit of a challenge. It's a lot of a challenge. Being able to see, of course, is a big challenge. The dexterity of your hands to make sure that you draw labs, handle any sort of fluid that could possibly infect you is most important, and making sure that you do that safely.
Captain Paul Reed will be in charge of clinical operations at the new hospital the U.S. is building in Liberia. The Public Health Service doctor has been deployed to hotspots many times, but for the father of 4, this assignment feels different.
My family's used to me traveling and being deployed for a number of different reasons over a long period of time, a 20-year career. This one has a little bit different flavor, obviously, and there's some expressed anxiety on the part of my wife and my kids, as you can imagine. But I think generally they know I'm going to be smart about what needs to be done, and I'll make sure that I'm safe, as well as the folks that I'm taking care of are safe.
But training doesn't happen overnight. The challenge is keeping pace with the fast-moving epidemic.
We can run 35 to 40 students per course. We can run 1 course per week. We intend to run a course every week until the demand goes away. And if that takes a year or 2, we'll run it for a year or 2.
A single infection control lapse can result in an infection of a healthcare worker. So we really want to make sure that it's done well, and that's why we're doing this detailed, in-depth training for anyone who wants to go over and assist with the response as an initial training. But also, the stakes are so high in Africa. If we don't stop it in West Africa, the risk of it spreading to other parts of Africa is very great. And if that happens, it could be around for years and a global threat for years. And that would have impact on how we do medical care in this country. That would have impact on travel and trade and economies and political stability. So the stakes are very high.
Those high stakes drive the CDC effort. But the question remains, can the agency move fast enough to combat the worst Ebola outbreak the world has ever seen?
Online, you can hear more from the healthcare workers we talked to on what's going through their minds as they prepare to go to West Africa. That's at pbsnewshour.org.